Good morning, everyone. I want to welcome you to the January meeting of the Inland Coalition on Aging. My name is Dr. Ben Howdigy. I'm the founding board chair and your servant here, serving the coalition and all the older adults, all the adults with disabilities, and other caregivers that we serve collectively. On our agenda today is we're going to review the key points from our last meeting. We like to do that to keep you apprised and so we can continue the momentum, the discussions, and just continue to move the needles in whatever topic we bring to you. We have a presentation today, a special guest. I'm very excited to have Justice at Aging here with us today. I'll introduce our guest speaker in just a bit, and then we'll share information about our next meeting. Next slide, please. So at the last ICA meeting, we had Susan Holland. She's the Senior Director of Programs with the Alzheimer's Association. Great meeting and great conversation. Also, Carmen Estrada was a speaker also, and we had some great discussion. What I love about this coalition meeting is that we have some topics that are current, that are relevant, that are applicable to the work that we all do. And then we have discussions together about the current state of affairs, the barriers, the gaps, and things like that. And what can we do to move forward? We had a good discussion about the committee that we have at the ICA. If you're interested in this topic, dementia and caregivers and Alzheimer's, feel free to reach out to us and we'll invite you to one of the committee meetings. Next slide, please. So a few updates for the Inland Coalition on Aging. We are looking for help. We're looking for your help. We're looking for folks who want to partner with us to get the word out. As you know, we are towards the end of developing the Inland Empire Master Plan for Aging. We're still seeking input. We're still wanting to connect with the community stakeholders, especially in areas where we might not have been yet, in rural areas and urban areas and organizations that serve people with disabilities, for example. We are interested in getting out the word about the plan. And so if you are interested in hosting or meeting with us or just have some suggestions, send us an email to info@inlandaging.org. We'd love to hear from you and see how we can work together to get the word out. Next is Carmen, our board treasurer, presented at a national meeting, and we were just so excited to have her present and be a part of that. It was the California Collaborative for Long-Term Service and Support's Rural Toolkit National Presentation. So as you know, we were featured in the SCAN Foundation's book on rural MPAs, Rural Master Plans for Aging, and they highlighted our work. So congratulations to you all who have been a part of the IMPA process. We were highlighted as a model there in that document, and then Carmen presented at a national presentation. And you're welcome to watch listen to or watch the presentation there and the link provided to you in the PowerPoint. So next slide, please. Just to remind you where we were, where we're going, back last year in February, we developed some work groups. We've had some work groups working through this whole time, helping us to develop the plan, the strategies, and also connect with stakeholders throughout the community. In March through August, we developed the implementation plan. And in June, we hosted a disability focus group to continue to get more input and continue to update that plan. August through December, we had meetings with several partners to just talk about implementation, strategy, and how do we continue to collect stakeholder input. And so now, winter, spring, and this spring of 2025, we are still looking for community comments on our draft. And so we will be making our rounds to meetings and presentations. And again, we welcome your ideas and suggestions for that. And in June of this year, we plan to release the MPA. So all this work, all these years is finally coming to what seems like an end, but it's actually the beginning. This is just the beginning. Once we roll out the plan, now we really got to roll up our sleeves and get to work and really develop those partnerships and collaborations to implement the Inland Empire Master Plan for Aging. So very exciting time of the ICA and the Master Plan for Aging. Next slide, please. Please help us spread the word. We have lots of marketing materials, lots of marketing materials. We are fortunate to have some sponsorships and funding to pay for the development of some very nice professional media tools. So please make sure you visit the inlandaging.org/media tab and get everything that you need to be able to share in your social media, your LinkedIn, other places. Please share widely. And then again, make sure you join us on LinkedIn. On LinkedIn, we are there and we have information. So please find us on LinkedIn and join us. If you're interested in a presentation about the IEMPA, please remember to email us at the email provided there on the slide, info@inlandaging.org. Next slide, please. All right, we're moving right along. Again, like I said earlier, I'm very excited to introduce our guest speaker today. Justice and Aging is a national organization that has been advocating for older adults for many years. I don't know, but I've followed them for many years and been able to work with them in various committees and things, and I'm just thrilled to have them here today. Sahar, uh, Takshi is a senior attorney with Justice and Aging, and she's been there since 2021. She works to advance equity for low-income older adults who are marginalized due to race, ethnicity, sexual orientation, or gender identity, disability, immigration status, English language proficiency, or other systemic oppression. Sounds like we're aligned, right? She's passionate about improving federal policies and programs that allow older adults to age with dignity, as well as educating legal and aging service providers and policymakers on developing equitable partnerships, outreach, and other programming. Her experience as an immigrant and an Iranian American drives her passion for advancing cultural competency, language access, and community-driven partnerships for federal programs. Please, let's give Sahar a warm welcome. Thank you, Sahar, for joining us. I'll turn it over to you.
Thank you so much, Ben and everyone. I'm really excited to be here and to speak with all of you about the work that we do. It's always exciting to talk about these topics, but I think especially right now, they feel very timely and very relevant to the populations of older adults that we all work with. Please give me a moment to share my screen because I do have a few slides. Okay. And is everyone able to see that first slide? Okay, fantastic. Well, hello again. As I mentioned, my name is Sahar Takshi, Senior Attorney for Equity Advocacy at Justice and Aging, and I will be talking about advancing equity for older adults today. A little bit about Justice and Aging, if you're not familiar with us. We are a national legal nonprofit. Our mission is to use the power of law to fight senior poverty. We do this through a combination of administrative advocacy, through systemic litigation, as well as through educating our network through resource creation, webinars, and a variety of other technical assistant type services. Our main areas of focus are around healthcare, and in particular, long-term care and home and community-based services, as well as economic security, such as Social Security programs, housing, guardianship, and other elder rights and elder justice services and programs. If you are not signed up for our listservs, I would highly recommend you do, especially over the last few weeks and in the coming months. We really have a great pulse on what's happening at the federal level and push resources out that are very bite-sized, easy to digest about how various actions impact the lives of older adults all across the country. So I would highly recommend signing up for those. And before I jump into things, I want to talk a little bit about Justice and Aging's commitment to advancing equity. So I'll talk a little bit more about, um, I'll be talking about this topic the whole time today and a little bit more about our commitment later on. But just to give you a little context for why we do the work that we do, at Justice and Aging, we believe that all older adults should have the opportunity to age with dignity. And in order to do so, we have to address the enduring harms and the inequities that are caused by systemic racism and other systemic forms of discrimination. So in 2021, we established a framework for advancing equity. And this framework guides the external work that we do, including, talking to partners like this, as well as our internal work as it relates to our hiring, our planning, the way we do our research, and so much more. Okay, so I like to start these presentations off by doing a little just kind of table setting, talking about definitions and introducing some of these topics. So I'll start off by talking about some broad themes relating to equity and aging. And I want to start with this image. It might be one that you've seen before. And this image tries to illustrate the difference between equality and equity. As you can see, equality might be defined as providing the same types of services, the same types of support to everybody. But that doesn't always help everyone achieve the same outcomes. And so when we're talking about equity, our goals might be to provide tailored support, tailored services to help all individuals achieve the outcomes that they want to have. And then in the third image, we might be talking about justice, right? Removing the systemic barriers so that there are no barriers for anybody and that everyone can achieve the same outcomes without having to have any services. A lot of the work that I do focuses on advancing equity, but I think the broader community of advocates that I work with, our goals are to ultimately achieve justice, right? No barriers to aging with dignity. Next, I want to talk about a term that I think probably everyone in this room is very familiar with, ageism. And ageism is very simply defined as discrimination on the basis of age, right? So when we think about ageism, we might think about the employment context, right? Folks not being considered for roles because they're too young or they're considered to be too old. We might think about media and Hollywood and, portrayals of older people versus younger people, portrayals of older women versus older men. Um, and those are all very real examples of ageism. But we can think a little more deeply too and recognize that ageism is present in a lot of areas of life, including many of the services that we probably interact with daily, right? Thinking about the barriers to applying for public benefits programs, what ageist structures are in place there. But in addition to age, older adults in our communities, they consider themselves to be part of many groups, right? Age is not the only factor that defines a person. Um, and sorry, I think my slides are a little backwards here. So when we're thinking about belonging to multiple groups, whether it's your age, based on your race or ethnicity, based on the languages you speak, or your national origin, your gender identity or sexual orientation, the culmination of those different identities is what we call intersectionality. And so a person can experience life differently based on their belonging to multiple different marginalized groups. And so when we're thinking about aging and other parts of one's identity, we have to recognize that aging doesn't necessarily protect one from other types of inequities. And in fact, older adults who belong to marginalized communities can experience enhanced or even unique types of inequities throughout their lives. So, two examples that I can share with you. One would be the experience of older women in the context of their economic security, their financial security. So we know that women throughout their lifetime experience a lot of disparities and inequities as it relates to income, such as wage gaps, such as being not being considered for high-paying positions. We also know that caregiving responsibilities are predominantly held by women in all over the world, but including in the US, and that has implications for employment for a lot of women as well. And so a lifetime of those disparities leads to older women having, on average, lower wealth and lower savings compared to older men. And that obviously has many impacts for housing, for their health, and so much more. Another example would be the experience of tribal older adults in healthcare settings. So, Native communities, American Indian and Alaska Native communities in the US, have some of the greatest health disparities of any population. And that is in part due to centuries of oppression against Indigenous communities, as well as ongoing barriers today, such as the severe underfunding of the Indian health services and complicated rules around enrollment for various other health programs. And so as a result, older members of the American Indian and Alaska Native community experience some increased health risks and health outcomes, negative health outcomes, such as an increased risk for chronic conditions such as diabetes and heart conditions, and a significantly lower lifespan compared to other populations in the US. And so that's an example of an inequity that might exist for tribal older adults, and it's exacerbated by other factors that older adults might face, such as, as one gets older, the inability to drive several hours to access the closest healthcare facility because there are not that many on the reservations, or limited broadband access on reservations, which might impact someone's ability to access information online or to, access their healthcare portals, many of which are moving to be online. And so there's layers of different inequities that members of the tribal elder community might be facing. So I'll move to talk a little bit about just who older adults are across the United States. So this data comes from the most recent profile on older Americans from the Administration for Community Living. And it found that just over 17% of the US population are people who are over the age of 65. And of that group, about a quarter identifies a member of a racial or ethnic minority. And then also of that group, almost 6 million people are living below the federal poverty line. You can, I think these slides will be shared with everyone after, and so these are all linked resources, but that report contains a lot of other information about older adults and the various groups that they belong to. And I tried to pull some data specific to California. And I'm sure you all have much more specific data to your local areas than is presented here. But in California, there are over 9 million Californians who are over the age of 60. And of that group, 32% are older adults of color. And also of that group, about 15% are living below the federal poverty line, which is a little bit of an increase over the last decade. So when we're talking about equity for older adults, and particularly advancing equity for low-income older adults who belong to marginalized racial groups or other groups, it's a very relevant topic because these older adults make up a very large portion of the population that we're working with. And as we're thinking about what equity means, right? What does it really mean to advance equity for older people? Um, we can think about the various systems and services that much touch the lives of low-income older adults. I'm not sure if this image is super clear for you, but it sort of highlights some of the areas, some of the fields in which inequities arise and then make their way down to impacting the day-to-day lives and the health outcomes and economic security outcomes of older people, right? So we can think about um, the role of policing and inequities, racial inequities that exist in policing, and how that might impact an older person throughout their lifetime. Um, Certainly, health, housing, and economic security, employment, all these factors, any kind of disparities that exist there will also continue to impact older adults. Um, and just to do a little bit of a deep dive into one of those topics, I want to talk about reentry for older adults. And reentry refers to people who are leaving incarceration and coming back to their communities. Um, and so this graph is from, I believe, a 2012 report. No, yeah, maybe a 2012 report. I'll have to look back at that. I apologize. It's linked here. Showing that while as since 1993, the population of older people who are imprisoned has increased. And so when we think about what that means for older adults generally, and particularly older adults who are leaving incarceration, we think about the inequities that lead people to become imprisoned, right? The many racial and ableist policies that impact who is incarcerated in the first place. We can also think about the types of healthcare or lack of healthcare that's available to people who are incarcerated. And then we think about those older adults who are, after being imprisoned for however many years, returning back to their communities and what their lives look like and the barriers they face, such as the impact of having a record on gaining housing, how inadequate healthcare for the duration of their incarceration might impact their health post incarceration, and so much more. And so this is just kind of a deep dive of one of the areas that justice and aging is really looking into. We have a series of papers on equity and reentry. If this is of particular interest to you, I would highly recommend looking at those. Okay, so we did a little bit of just kind of definitions and overview. I want to move to talking about the national perspective on equity and how it impacts the lives of older adults. I do want to just say a caveat. I created this presentation last week, and since then there have been some national developments, which I'll be sort of talking about as we go through them. But I will start off with a sort of less recent um, piece of the national perspective. And that is two court decisions that relate to the topic of intersectionality. So, as you remember, I just talked about intersectionality being the existence of more than one marginalized identity. And that's a term that was coined by Professor Kimberly Crenshaw in an article that she wrote where she's arguing that intersectionality is an important part of the legal process, and that's something that we should consider as we're trying to advocate for plaintiffs. And in that article, she highlights these two cases to show that intersectionality is not really something that is baked into our legal process. Our laws don't really think about discrimination in that way. They don't really think about the intersection of different types of discrimination. And so she points out these two cases. The first one is from 1976 in a Missouri court, where um, the plaintiffs were a group of Black women who were being discriminated against in their workplace, and they wanted to bring a Civil Rights Act claim claiming that the discrimination was against Black women specifically. And the court refused to see it that way, said that the Civil Rights Act only allows claims for women or for people of a certain race, but would not look at them combined. And this had a few impacts, right? One, it means that those plaintiffs were sort of unheard in their claim, right? They weren't able to demonstrate the full picture of what they were experiencing. Two, the court refused to set a precedent for any sort of future intersectionality claims. And third, the plaintiffs weren't able to get the relief that they wanted, right? Because when the court looked at just the gender-based claims or just the race-based claims on their own, it found that there wasn't enough to go off of. Another case, though, that Professor Crenshaw highlights in her article is from 1980, so just a couple years later in a different jurisdiction. And that court did allow the plaintiffs to combine the two different types of claims, two different gender and race-based claims. However, found that one of them has to be neutral. And in that case, decided that race was a neutral factor. And so you can see that, one, there's inconsistency in the laws, in the way that the courts approach intersectionality. And also that even when they do, it doesn't always feel super, it's not exactly getting to the root of the problem either. And so I bring these up just to provide a perspective of how courts treat these claims and why it's so important to focus on other types of advocacy, whether it's administrative, whether it's through, plans on aging, which I know so many of the people in this group are working on, to ensure that older adults who belong to marginalized communities are able to get the services that they need throughout their lives. So with that, I thought I would bring up the Older Americans Act, which I think is probably a resource that you all are very familiar with. But the Older Americans Act is the main sort of federal vehicle that addresses the lives of older adults in the United States. And it provides a lot of funding and sort of oversees many of the services that older adults access throughout the US. The Older Americans Act also requires that these services be targeted to older people with the greatest economic and social needs. And social needs is defined as, in the most recent regulations that were released last year, as including things like physical and mental disabilities, language barriers, racial or ethnic status, and Native American identities, sexual orientation, gender identity, and sexual characteristics, and other needs as defined by the state and by area plans based on their local, what they're seeing locally. And this is super important because this, in its own way, is talking about intersectionality. It's talking about older adults who belong to some of these groups, one or more of these groups. And so, as I was saying, even when courts aren't thinking about intersectionality, we can use vehicles like the Older Americans Act to promote that kind of thinking and to ensure that older adults are actually able to learn about and access the kind of services that they need. And what's really important about the regulations is that it creates that opportunities for states and local areas to identify the communities in their area, in their service area, whether they are racial communities, immigrant populations, language groups that they want to focus on because they know that there is a need there. I'll briefly go over just other areas outside of the Older Americans Act that sort of, in their own way, try to touch on the concept of intersectionality and how they might impact older adults. One of the most clear ones is the Affordable Care Act, Section 1557 of the Affordable Care Act. Sorry for the spelling error there. It's 1557. And this is actually the only federal law that um, sort of explicitly calls out intersectionality because it allows for folks to have an individual right of action under multiple different identities. So whether it's on age, race, disability, um, folks are able to, if they feel that they've been discriminated in almost any healthcare setting, they can bring a case under Section 1557. Other laws like the Fair Housing Act, Americans with Disabilities Act, Civil Rights Act have implications for older adults as well, and so provide protections in different ways. If you work with any type of legal organizations under the ABA's standards for civil legal aid are also required to think about intersectionality in their work. And lastly, state and area plans on aging increasingly are viewing older adults in this way as well. They're talking about older adults, not just generally, but older adults who belong to specific marginalized communities and ask that their agencies and their partners do so as well. In addition to those state plans on aging, area plans on aging, there's a national plan on aging that's in the work. And this is a framework that tries to identify opportunities and challenges at the federal level. So I've listed some of the four, I think they call them domains, that the National Plan on Aging is looking to address. Those would be age-friendly communities, coordinating housing and supportive services, increased access to long-term care, and aligning healthcare and supportive services. The National Plan on Aging sort of works off of what's being done at the state level and at the local level. And so it's really important as state plans on aging, as multi-sector plans on aging are being developed, that they continue to uplift the concept of advancing equity, the concept of intersectionality, because it really does impact national efforts as well. But I am compelled to also talk about recent developments. So I know the last several days have been an absolute whirlpool, and there have been, headline after headline, many of which impact older adults, frankly. And so I wanted to have a couple slides on that and talk about how they might impact the work that you all do and the work that Justice and Aging is doing. So you probably have seen that there were executive orders rescinding the Biden era executive orders that were calling to advance equity across federal government. To clarify, executive orders on their own they don't create law, they don't change law, they really are just a kind of a proclamation of what an administration intends to do. So as of now, the executive orders have not, there's no law in place that we can't be advancing equity, that we can't be thinking about these topics. But certainly it does have implications for what is to come and how those changes, when they are in effect, will impact the lives of low-income older adults. So we know that we know a few things. So the executive orders, as they come out, largely cause a lot of confusion, and they have what's called a chilling effect. So for older adults, this might mean that they choose to not apply for a public benefit or to withdraw from a public benefit. Some individuals might choose to self-deport if they feel like they would be the target of some of these executive actions. And so it's really important for state and local level advocates to be thinking about the populations in their service area and continuing to have communication with them and continuing to do outreach. It may be in a way that's a little different because there is a lot of that confusion and fear that's going around. And I'm sure that's something that your group has been thinking very deeply around. Um, the executive orders and the other actions that the administration is taking also have an impact on, even though they're not changing law, it means that the agencies largely are becoming understaffed on any of their offices that impact equity, that impact DEI, actions. So, for example, the Social Security Office of Native American Partnerships, I think, is, you know, was already kind of understaffed, is significantly more understaffed at the moment. And so those impacts trickle down. We also know, I think, as of today at 5 p.m., but we've heard reports that even before that, there's been a pause on public benefits, certain public benefits, excluding Medicaid and Medicare. And so many of the older adults in your communities might be seeing that. That's definitely something that Justice and Aging is monitoring and continuing to report on. We ask that as you learn more from the older adults in your communities, um, you can share those stories with us, and that really helps our advocacy. And we continue to share resources and solutions to the extent that we can with you. So I apologize. That's not the greatest ending to the section of this presentation, but I wanted to before I stop talk a little bit about Justice and Aging's strategic initiative to advancing equity and some of the resources that we have that might be of use to you during this time. As I mentioned way in the beginning, in 2021, Justice and Aging launched our strategic initiative to advance equity. This is a framework that covers our programmatic work, so all of our litigation, our administrative advocacy, our presentations that we do, and the resources we put out, as well as our internal work as it relates to staffing, research planning, basically every aspect of our organization. And the aim of it is to ensure that all our work is centered around advancing equity for low-income older adults who belong to marginalized communities. As I mentioned, these are some of the one prong of our work is supporting legal and aging services programs all throughout the country. So we host a variety of webinars, issue briefs, we send out email alerts, and we have a myriad of attorneys who are experts in Social Security and Medicaid. And so as changes are unfolding, as we learn more, we're putting out really useful resources. So I would highly recommend signing up for emails just for that. We also provide technical assistance and case consultation. So if you meet an older adult who has an issue that you're not really sure how to handle, or maybe it's not even about an older adult, it's just about a topic a little more generally, and you're looking for some legal help to work through it, or you're looking to be connected with an advocate or with the type of resource, we provide those services as well, and that's all for free. You can reach out to us at our Justice and Aging email. I'll make sure to put that in the chat as well. And we do have a lot of resources from the past that are online. One of the ones I want to highlight is our equity analysis tool. It looks like this. It's essentially a series of questions to evaluate a case, a project, an effort, a policy for its impact on older adults who belong to marginalized communities. It's not, it's meant to be very flexible. And so we found that some folks find some of the questions to be more helpful than others for the type of work that they do. They might find that this is really just a starting point for them to have deeper conversations around how they advance equity. But it's a tool that I wanted to share with you, and that it's also linked later on in the presentation, so you can access it online. And yeah, I wanted to end with a list of resources that you might find useful. The first is the equity tool that I just showed you, and then a series of other toolkits, presentations, sort of guides from us and our partners that relate to this topic. And I think that is it. Okay. I'm going to stop there. I think there's about 20 minutes left on the hour, so I think I will stop and we can maybe move to questions.
Thank you, Sahar, for the timely presentation. Equity is one of our goals with the Inland Empire Master Plan for Aging. Although we made an attempt to integrate equity at all aspects of our plan and at every goal, we thought it was so important that we highlighted it as a separate goal, safety and equity. And so we are looking at all of our goals, looking at all of the communities that we're working with, and ensuring that we're ensuring equity across the board. So thank you. This was very timely, and for the coalition members here, this information is so valuable for not only us, the Inland Coalition on Aging and the MPA efforts, but really for your organizations. And I highly recommend that you sign up for the Justice and Aging newsletters, and all their emails are fantastic. Great trainings they have regularly. They provide some great tools, handouts that are easy to understand, easy to share with your clients that you serve, consumers, patients. And so, again, I just want to thank Sahar for a wonderful presentation. Are there any questions? Yes, Elizabeth.
Hi. So, I am a consultant with ICA and helping with the MPA and thinking about how to facilitate the projects that we're doing forward. And some of that funding might be federal funding, some of it might be local funding, state funding, or from private groups. And so my question is, it's kind of hard to figure this out, I guess, but with using all of this equity language, which is important to us, how do we navigate that potentially with applying for funding that may not look highly upon these endeavors?
Yeah, that is a fantastic question. And I think something that is on the minds of everyone who is doing this work, especially when quite literally the words equity or DEIA are such a crux for being under attack. Um, I think this is an opportunity for organizations to think a little creatively about the language that we use that is still advancing the initiatives that you want to be advancing. I think there's sometimes a temptation to, not target at all any particular populations or to focus on those quote unquote safe populations, such as using words like rural or veteran without calling out, the other inequities that exist even within those populations. But it definitely is a challenge, especially during times that feel so uncertain. I think even at the federal level, there's been indication that they're looking not only at things that are titled equity or DEIA, but things that are sort of masking as being equity related or DEIA. So I think there's going to be a lot of creativity that individuals and organizations are going to have to be figuring out at this time. I'm sorry, I'm not trying to evade your question. I don't have a list of like alternative words that we can use, but it is definitely something that we can provide technical assistance on and work with you. Some of it might depend on what kind of federal funding you're looking at. For example, the Older Americans Act, as I mentioned, in the Act and in the regulations, calls out specific populations, right? And so, in theory, using the language that's already in the Act is maybe safer than using a word like equity, right? But it definitely does depend on the specifics of the what the funding that you're looking at and whatnot. So I would highly recommend reaching out to us, and we can talk more if you'd like.
That was a good question, Elizabeth, and got me thinking about the organization called Frameworks. They are an organization that works with I'm looking at their website, researchers, strategists, and passionate communicators about how do you frame the work that we're doing? How do you frame aging, for example? So I would point folks to frameworksinstitute.org to see if there's some helpful information there that could help us to frame the work that we are doing, reframe, or find the right frame to frame the work that we're doing. But yeah, t- uh, interesting times. Ernie, I see your hand up. Thank you, Elizabeth.
Yeah, so this may not be well received, but I will say this, and I'll use an example. I went to the State Bar Conference a few months ago up in San Francisco, and you know, I will call myself center left, middle of the road, and I was not permitted in that registration to register without indicating my pronouns. Now, I got to tell you, I have a friend who I served with in Guantanamo um, as a him, and now it is a her, and she is serving on the Marines, and she may be pushed out. Now, from a retired service member perspective, that's disgusting. However, I will note, and in this community, I know that there are several people on this call that have heard me speak and know that I'm somewhat passionate about what I do. That said, in this community, I think we get lost in terminology and that's off-putting to the right. And if you require pronouns or you use terms, that turns people off immediately. And I think the challenge to this group, I have no intention of stopping. I have no intention of not supporting Emma when she's potentially forced out of Camp Pendleton. Um, those are really off, but I think we need to figure out how we rebrand what we do because I think this election has rejected some of those terms, not what we do. It's bad to abuse adults. Okay. I sit on the Elder Abuse Forensic Committee, I'm a core member. It's bad. But how we brand what we do and how it's presented, we have become polarized. And I'm the guy in the middle, and I'm sitting here watching. And I think to this group, I think that's a challenge because not just in this group and the other boards, committees I sit on, it's a challenge. And if the first thing out of our mouth shuts down the people that we're going to have to deal with for either 2 or 4 years, we're not helping our people. And sometimes we gotta get crafty. And I'm not advocating that we lie at all, but we need to rebrand. It's bad to be bad to old people. I don't like bad people. I advocate against bad people, bad housing providers, bad consumer providers. But so, how do we do what we do without just putting it this way, pissing off the people that are sitting in Washington? And if they want to play that game, that's our challenge. So, I don't know how this goes to this group, but Sahar, I heard you use many terms that cause people to close, to stop listening. And if we say, well, you're pissing on a veteran, we focus on veterans, seniors, and disabled. As people have heard me talk, often one and the same. So let's focus on that. And I support everybody using pronouns or using that, but we need to know how to communicate to the people that don't want to hear us talk. So I could say a lot more, but I think I've got my point across. And that's a challenge for us. And it's going to be a challenge for 2 to 4 years.
Thank you, Ernie. I know that regardless of the administration in place, I see us having to frame what we're doing when we're asking for funding at times, right? We have to frame everything in a certain way to qualify for funding, to get funding. And so framing is something that we just need to do in general. Interesting, the word equity to me, I've always looked at it as the same as the word accessible, you know. Are things accessible? And accessibility is not a bad thing. Accessibility is a good thing for everybody, right? I'll use the example of an accessible building that has a ramp and grab bars and elevators, and the building is physically accessible to everybody. Accessibility is good for everybody, not just people with disabilities that maybe use wheelchairs. Accessibility, being able to access buildings or locations or shopping centers and everything is good for everybody, right? You might have already heard this example of the mom with the shopping cart or the person with carrying groceries, and the walkway is flat and firm and accessible to everybody. Accessibility is a good thing, and I think equity, one of those terms that it's good for everybody. It's just how we frame it, right? That um, is
Here's the
important.
challenge, Ben. Okay, so I'm dyslexic. I had a hell of a time with the state bar to take my bar exam. It was just utterly absurd. I had a hell of a time with my law school. And that was back in the 90s. I mean, it it was a challenge, but in a way, what I'm suggesting is the people on the right, center right, and all the way over the right have taken issue with the words that we use. Okay. I am by no means disabled, although the VA will tell you I've got a pretty decent disability rating. And by no means am I disabled because I have dyslexic and I view things differently. But it's how we go about it. And we're going to need to pick some other words and we're going to need to pick some other framing. Because if we continue with the words that we have, the framing that we have, that's been roundly rejected. And the administration in place right now, it's going to push back. And those places that we need to go to outside of the state, because the AG's office, I think, is pretty adamant about protecting it. But we're not just advocating, I don't think, for California, although we do set standards. So I think um, it's we have to change costumes. The core of what we do underneath the costume will be the same. But I once had a commander tell me, you're a pretty smart kid, but it's a real pain to see you pounding your head against the wall when I know all that you need to do is take a step back and you won't hit the wall anymore. And that's what I suggest. If we go to battle with them, we're going to lose. So let's figure out how to take a step back from the wall and change our costume. Otherwise, our
Yeah.
clients are not served.
Thank you, Ernie. I want to make sure we leave time for these questions here. How is the announcement yesterday about the federal funding going to affect this? Did we get to that yet? And how can the announcement of surrounding federal grant funding going to impact this work? And do you see Justice and Aging working on any type of help with rewording, rebranding, equity conversations, and content?
Yeah, definitely. I'll start with the federal funding conversation. So I know that's an area that is uh, we're learning more about rapidly. I think even as of like 10 minutes ago, I got another alert. And so I think that's largely going to be what it's like for the next several days. The funding freeze will have an impact on certain services, including ones that older adults might access. It'll have an impact on research, even some relief programs. I think what is important to keep in mind at the national level is that there are a lot of groups like ours, similar to ours, that will continue to challenge those types of actions. Um, and it's really important for folks that are kind of on the ground who work with older adults or a little more, connected with older adult communities on the ground, to to see what's happening and to, I would ask sharing with us if you learn about particular impacts on an individual. It really does help national level advocacy to know what's happening on the ground, to have those stories to share, because sometimes those impacts are, there might be impacts that are not what was advertised as what would happen, or they sort of help us develop better claims. I apologize again for not having, I'm not able to read the tea leaves and give you more information about what might happen, but I do ask that you keep an eye on things and share with us what you learn, and we'll continue to share with you what we learn. I think the other question was around support around rewording and rebranding. I think that's really interesting, and I hear folks in this group sort of taking different perspectives on it. I'm not sure if Justice and Aging is planning on doing anything around the sort of language piece, but there are other groups that are. One thing that comes to mind, I recently went to a presentation by the Raven Group that has been looking at the impact of certain language and how people receive it, right? Not even considering like government, but just person to person. How do people respond to different types of language? And even things as simple as saying DEI versus diversity, equity, inclusion has a big impact for people, right? The acronyms DEI have become highly villainized, or you see them in headlines, you see them in the EOs. But when you say diversity, equity, inclusion, that resonates with people, especially inclusion. I think they found is that piece that a lot of people relate to and that most people are for. So I don't know that Justice and Aging is planning on doing any work around that. If we do, I will make sure to share it with this group, but I would encourage you to share resources internally as you come across things like that. And like I said earlier, if you are working on something and you do want to workshop language with us, I mean, that is definitely something that we can provide technical assistance on. So I'll put my email in the chat and you can always reach out to us and we can work on your specific language for what you're trying to do.
Well, we are at the end of our meeting. Thank you so much, Sahar. Appreciate all the information you brought to us, and we look forward to continue this partnership with Justice and Aging moving forward. So hopefully you can make it to our next annual conference. And
yeah,
okay,
thank you so much.
You're welcome. Let's move on to the agenda. Our next meeting is Tuesday, February 25th, 11 to 12. Please join us on that day. Next slide. We will be sending you a survey, please. These surveys, we read them. We read every single comment, and they really help us to improve the information, the meetings that we're providing. So please make sure you complete the survey. I just want to thank everyone for attending. Thank our presenter. Thank Inland Caregiver Resource Center, Janelli, and the team there for their support here with technical support. And Elizabeth, our consultant, thank you for joining. And all of you have joined us and been with us. And if you're new today, thank you. Please go to our website and join as a professional member. You can join for free, inlandaging.org. Thank you for all that you do.